Boy, especially earlier on this morning, if there's anyone who feels like they're being told that their likelihood of access of an investigational treatment outside of clinical trial is somehow going to jeopardize the ultimate approval of the drug or existentially create a threat to good commercial practices or good science, I've got good news for you. And I also wish that I attended a conference like this 6 years ago when I got involved in ALS, because I think I could have saved myself a lot of research in understanding the history and the conventional state of the space. But having done the work myself, I noticed a lot of opportunity to transform and hopefully evolve to a situation where it's not just a few patients, it's not just 1,000, or a clinical, paraclinical access program is not just for a handful of patients at the end of a clinical development process. We're only going to get so far if we ask companies to act on compassion alone. We have to think about what their considerations are, what the hazards are, and some of them are legitimate. I would argue that those hazards are manageable factors rather than existential risks. So the key for us is to think of ways of managing those factors to make meaningfully sized, broad, and early access programs a reality. It's a myth to say that intrinsically an access program is a threat to good science. It isn't, I would argue, and I know that there's been really good comments made earlier, but I would say that maybe too much emphasis has been put on this balance between the needs of current patients who want access and the needs of future patients who want swift approval, or patients who haven't been diagnosed yet who would benefit in the future. You can have both. So what did I do? I created an organization called the ALS Emergency Treatment Fund. And this was during the time that my dad had ALS. He was the second immediate family member of mine to be diagnosed with this terrible disease. We wanted to do something that could make EAPs easier for drug companies to undertake. Unfortunately, in small companies, especially the kinds of companies that have drugs at medium stage, like post-phase 2, or maybe even are in phase 2 right now, and especially in diseases like all of ours in this group, these aren't the kind of companies that can easily do an access program. These are lean, cash-light, science-driven companies. They also don't necessarily gain from the public reward when drug goes to market, because they may not be the company that brings the drug to market. So we have a duty to make it commercially viable right now to these companies. All right, how do we do it? Like I said, we're a nonprofit company. As a nonprofit, we have some real advantages that are beyond the scope of a for-profit company. Firstly, we can raise charitable resources. I put that down here as the second item. For the startup. And by startup, I mean the manufacturer of supply to bring to clinics for an access program. Regulatory negotiation. We have a structural alignment of interests with patients. And when you have that alignment of interests, you have a little bit different angle with regulators when it comes to negotiating cost recovery, when it comes to discussing what's going to happen in adverse events. And there have been historical cases of abuse sometimes when the company has done that. They might have misaligned interests. We don't. Also, we have a clinic relationship that makes it more likely that we'll have less expensive administration of an access program when we're providing a service to the clinic, providing them the option of giving treatment options to their patients, as opposed to the other way around, where clinics historically, if they're working with a for-profit company, they're charging a fee. That's how they keep the lights on. Yeah, when it's research purposes, you have to fund the whole thing. When the program is for treatment purposes, you as a drug company or a nonprofit sponsor don't have to fund the whole thing. You can have cost recovery, and that means involving other charitable organizations, private insurance if they pay because it was billed through similarly to an off-label program, or patients themselves. They can contribute. We're trying to partner. I think there might be somebody here from ALS Association. There's very good organizations that are focused on patient services. And I would advise anybody out here that wants to do a similar thing, engage those large fundraising services. That's something they can get involved in for the betterment of patients. That's an expandable access program. Lots of patients, equals lots of data. When you have lots of data, you underscore the reward to the company. You can do patient profiling in a heterogeneous disease like ALS. You can get right down to the responders, understand which pharmacogenomic variants appear to be really the ones to respond, and that's a nugget for companies looking for better patient selection. So I apologize for speaking so fast, but we have a clear win-win in the ALS space, and we think that we can export this to other disease areas as well. So nonprofit third party can do early expandable access programs for a meaningful proportion of the patient population. And when you do that, you can learn from patients and benefit the commercial prospects and the speed of getting the drug approved. Thank you very much.